Welcome. In this session we will talk about the Physician Handoff mPage as well as look at this new tab that's called Clinical Events. So when you first open the chart, it goes to Results Review and Recent Results. We want to talk about this new tab called Clinical Events, and if you were to click Clinical Events, you might not initially see anything. However, if you right click and go to change search criteria, click Clinical Range, and then change the date to go back for a few years, or forward and back to the appropriate clinical range, and you click OK, this data will change significantly and you'll start seeing clinical events. Now you may ask, what is clinical events? Well, clinical events are critical events during the stay, so episodes of hypotension, chest pain, cardiac symptoms, transfer to ICU, blood transfusion, critical labs, critical test results, anything that's called back the nurse considers as a critical event would be listed here. So for instance, this one, it says discharged AMA. You might see that they got discharged AMA. On this clinical event, you might see that manager supervisor was called because the patient was managed difficultly on the unit, and they may have had chills from a medication called morphine, and which is then got documented as an adverse event. Other times you might see that the physician might have been called and for a clinical reason. So this tab in general is very important to review, such that you can actually see the kinds of clinical events happening and review them in one spot. Everything from AMA to blood transfusion to hypotension to arrhythmias, falls, any adverse event is listed here. And it's very important for us to know, and everything displayed during this session is actually intentionally fake to protect privacy. So nothing on here is actually real. Now, the next thing we want to talk about, so once you've reviewed clinical events, is this Physician Handoff mPage. And if you click on this button on the top, you can also find that in the chart and in the links on these menus up here. You might be able to find Physician Handoff under View, for instance, if you don't see the button. So if you click on the Physician Handoff mPage, it lists the current patient list that you're interested in. So you could actually go to any part of the hospital and click and open up that list. Your provider group list would be listed here. So for the sake of confidentiality, we're going to leave it on this fake location with fake patients, and we're going to describe what this page is all about. So one can sort by location. This is the location of the patient. One can sort by patient name, alphabetized by patient name. And of course, if you hover over the patient, you'll see more information like their PIN number. And then you can sort by physician contact. You can also sort by diagnoses. And one can actually interact with this very nicely. There's three places where you can interact. You can click on the name, which will open the chart. You can click on this right arrow, which will open up the encounter summary, or kind of like this summary that you want to communicate from one physician to another, or one provider to another. Here you would say, for instance, they came in with chest pain, they have chronic kidney disease, hypertension, had hypotension, and transferred to ICU for possible sepsis. Right? So you can put whatever summary information you'd like and click Save, and notice how it got saved like that. Actions would be perhaps follow up with ID and determine if antibiotics are still needed, and click Enter. And notice that's a follow-up item, and I can add another one, check H and H, like that. Situational awareness might be patient failed swallow eval, please do convert meds to IV, place for a PEG. So one can add information about the patient. Then it also calculates your length of stay, and because the patient currently has no diagnoses entered, there's none showing. However, we can add it. And so once you click like that, all that information is saved Notice, and you can toggle it. It's not official record, and it can be used between physicians to take better care of patients. So if you click Add, and you say I'm the attending physician, and you can quickly add a diagnosis. Here I might say sepsis, and select that as a diagnosis. And then I might close this down, and if I click refresh on this page, it will show sepsis here as a diagnosis. And also I can assign, click here on this physician assign and click assign here. So now guess what, I've assigned myself to this patient. And you can batch assign yourself to many patients. If you click on physician contact and say I want to be the attending physician or the covering physician for today, and click assign, and so I basically am now the covering physician. Alternatively, you can assign someone else physician information. Let's say you click physician contact and you know the following physicians are someone else's. You can type in the other person's name and click assign, and it'll assign that physician to those patients. The benefit of this is that if, for instance, I were to click on male 4-year and open up the chart saying that I'm attending or I'm a nurse, I can easily see who is the attending on the case simply by looking at provider contact. This field, provider contact, dynamically changes from who is listed here. So anytime we make a change here, the nurses and unit secretaries and everyone in the hospital knows who to contact in case there's issues and questions and concerns. So please use the physician handoff mPage. Please add diagnoses there. Please manipulate their patient summary, actions, and situational awareness. Please add diagnoses into the system. Please use the physician contact field, as that is where the information in this physician contact field actually transmits to the banner bar, and it can dynamically help the care staff of the hospital get a hold of you. Thank you. This is the end of this session.